COVID case counts reaching record levels, changing guidance right now, kids heading back to school amid the Omicron surge. There is a lot to process right now. So joining us with some much needed insight is Dr. Shira Doron, the hospital epidemiologist at Tufts Medical Center. Dr. Doron, thank you so much for being here this morning.
Happy New Year.
Happy New Year to you, too. Okay, we read your tweets about the new guidelines from the CDC to stay home for 5 days after testing positive, and then you can end your isolation after those 5 days if you don't have symptoms or they're clearing up. Some people balk at that. Why do you like it?
Well, there are four main reasons why I think the time is now to cut down that isolation. And the first really is that society is truly at risk of grinding to a screeching halt, given how many people are getting infected with this really contagious variant all at once. And that's not politics, and it's not putting the economy ahead of public health. That is public health. We need to keep the lights on, and we need to keep food on the shelves, and schools need to be open, and the shorter isolation will help. And the second reason is that a 5-day rule really concentrates people's energy, which is not unlimited, on mitigating risk when the risk is highest. Third, shorter isolation incentivizes people to test, since a positive result won't disrupt their lives as much. And last, it acknowledges that we're moving into this phase where it's okay to accept some risk of transmission of the virus because it has become less dangerous for most people.
Okay, the cases do keep setting records every day coming out of the holidays. It seems that will likely continue. Will you be changing your behavior in the next few weeks at all? And should we still be making decisions based on those numbers?
I don't think policy decisions should be made based on case numbers alone, because the majority of people in Massachusetts are now not at risk for serious complications of COVID-19, regardless of how rampant it is. But I definitely think individuals need to think about whether they want to change their behavior, depending on a number of factors. If you're an unvaccinated adult, if you're immunocompromised, you should be staying home until this wave has passed. I'm not worried for myself or my family because we're all vaccinated, but the hospital staffing situation is worse than I ever imagined. And my husband's a surgeon and he needs to be available for emergencies. So we've decided to take a few more precautions over the next couple of weeks, especially around gatherings, so he doesn't miss work.
I know it has been so difficult for healthcare workers, and we thank you for your hard work, too. Parents are getting ready to send their kids back to class tomorrow, and a new school sports season is underway. What advice do you have for them?
Well, there's a lot of COVID out there, more than ever before. So there will be cases in school. There will be transmission events. But for most kids at this point in the pandemic, the risk of participating in those things is still less than the risk to their mental health and well-being from pulling out of those things. So each family should decide for themselves what risks they're willing to take.
Okay, we hear a lot about pandemic versus endemic, which brings us to the question, are we just going to have to find a way to live with COVID-19 at this point? I feel like a lot of people are coming to this realization right now.
Yeah, I mean, it's too late to contain the virus. We can argue about what might have been done differently in the past, but it doesn't matter because we are where we are. So yes, we need to learn how to live with COVID-19, protect those at highest risk, and stay away from fear-based decision-making that causes more harm than it does good.
Okay, Dr. Shira Doron, the hospital epidemiologist at Tufts Medical Center, thank you so much for joining us this morning.
Thank you.